A third here, please. I'm going to ask Karen to take us through the notice, summons of meeting and attendance. Thank you. Karen.
Thank you, Chair. Members, you are hereby summoned to attend the meeting of the Health and Community Committee, which will be a hybrid meeting conducted remotely via WebEx and physically in the Council Chamber, Guildhall, on Thursday, 16th of November 2023 at 4 p.m. So attendance, Alderman Cook. Sorry, Alderman Guy.
Here, Karen, online.
Alderman McMorris.
Here, Karen.
Councillor Jason Barr.
Here, Karen.
Councillor Paul Boggs.
Shaw, Karen.
Councillor Caitlin Devaney.
Apologies.
Councillor Devine. Councillor Donnelly. Councillor Alex Duffy. Online.
Yeah.
Councillor Duffy. Councillor Heaney.
Shaw.
Councillor Hutton. Councillor McDade. Councillor Lillian Barr.
Here, Karen.
And Councillor Tierney.
Here.
Thank you.
Thank you, Karen. Thank you, members. The next item on the agenda is the broadcasting statement. So I would like to remind everyone present at this meeting in the chamber or in attendance remotely that this meeting will be broadcast live to the internet and will be capable of repeated viewing. The broadcast may be terminated or suspended in accordance with our protocol. Due to your attendance at this meeting, you are consenting to being filmed and to the use and storage of those images for broadcasting or training purposes and for the purpose of keeping historical records and making those records available to the public. Members and approved speakers are reminded to only have their mics and cameras on while speaking at the meeting and to use the chat facility to highlight a request to speak. A copy of the Council privacy notice may be found on the Council website at derrystrabane.com. Item number 4, members, is declaration of members' interest. They can be declared now or as they arise in the meeting. Councillor McDade.
Thank you, Chair. I just, as an employee of the Western Trust, just a declaration of interest for the deputation. Thank you.
Thank you, Councillor McDade. Any further? Alderman McMorris.
I just have family members that work for the Trust as well, just declare that. It's not personal, but it's family members.
Councillor Duffy. I'll go first and I'll let you. I'll also declare an interest as my wife is an employee of the Western Trust and Councillor Duffy's husband is also an employee of the Western Trust as well. Members, item number 5 is our deputation and we're to receive representatives of the Western Trust to brief us on their winter preparedness planning.
Thank you very much.
Get your tongue around that. And I'm going to hand over now to Teresa Malloy, the Director of Performance and Service Improvements. Sorry. Teresa.
Is that on, Chair?
Yep.
Okay, thank you. Well, thank you, Chair, and thank you, members, for receiving the deputation today. We had asked to come and brief our councils on our winter preparedness plan. I just want to introduce, first of all, myself. I'm the Director of Performance and Service Improvement in the Trust, and I have responsibility for all of the corporate planning and business continuity arrangements, as well as other services in the Trust. And to my far right is Brendan Lavery, Dr. Brendan Lavery. Brendan is by profession an ED consultant, and he's also our medical director. And then we have Dr. Maura O'Neill, and Maura is newly appointed and is our Director of Communities and Older People's Services. I'm going to start by saying that we have a very steady flow of people who come to our two Type 1 emergency departments here at Galvin and in the Southwest Acute Hospital and to Omagh Hospital for unscheduled care. And the purpose of a winter preparedness plan is to anticipate that that will be a time of increased pressure for those departments and for our trust more generally, and that we should begin to prepare for that early in the year. And in fact, we began our winter preparedness planning in June of this year, and that was done not just within our trust, but across trusts and at a regional level. And we had a regional workshop in June and further work that was done beyond that. So just to give you a little bit of perspective on how early the preparedness planning starts every year. If I go on to the first main slide then, please. Thank you. Within the regional planning that's been happening, we have been asked as trusts and within the ambulance service to focus on 3 primary priorities. And they're the priorities that are judged to have the highest impact across our services. And you can see on the slide, those 3 high impact areas are that we should all work to maximise ambulance capacity. And by that, we mean the amount of time that ambulances are available to see and treat patients who are called through 999, and to minimise the amount of time that ambulances wait outside our hospital facilities to offload their patients and have them transferred to hospital services. The second is to reduce time spent by patients in emergency departments who are awaiting a clinical decision and their next stage of care, if that's relevant. So that is to minimise the time that patients spend being assessed and then decisions being made whether to discharge those patients or to admit them or pass them on to another trust service. And the final of the 3 areas is timely hospital discharge for patients who are medically fit for discharge. And I think we're all very familiar with some of the issues and difficulties that we as trusts and individuals who receive our services and who are in hospital receive in ensuring a good timely discharge, particularly if they have complex needs. So it is really focusing on that area. So just to say to Council that in terms of our work to focus on those 3 areas, we did submit our plan to the Department of Health in September. And we did have an independent scrutiny with some experts that were brought in by our department to review those plans. And we did publish then our plan on the 4th of October. So you will find it on our website. And you'll also probably know that the Department of Health held a winter summit on the 4th of October. And on the website, and the website address is published there on the slide, the overall regional winter plan is available. So I'm going to just step through then the main areas of our winter plan for councillors. Next slide, please. The first of the 3 priorities is that we should maximise ambulance capacity. And I suppose I want to start by saying that we are one of the most effective trusts in ensuring that ambulances are turned around very efficiently at our emergency departments. The last set of figures that we have, which is September, looking across the region, is that 76.9% of patients were handed over by ambulance colleagues to our emergency department care teams within 1 hour, and 35% approximately within 30 minutes. And that's one of the best in Northern Ireland. So the actions that we're taking in conjunction with our ambulance colleagues is to work with them to support handover through enhanced coordination and smoother patient transfer. And we have specific resources which are given to us by the ambulance service. We call them our halos. So there's one available at Altnagelvin and also at Southwest Acute Hospital, and they are liaison officers. And they work with our ED teams to ensure smooth handover. We also are trying to maximise ambulatory capacities to reduce the need for ED attendance and obviously admissions. And that is primarily through making direct GP referrals available and having our community teams working out with vulnerable staff, and particularly in nursing homes in the community. Of course, we want to get ahead of anyone needing our ED or feeling the need of our ED, so we are working on more effective use of community services and pathways to maintain people safely at home. And we have set up 5-day-a-week frailty clinics at both hospitals to make those available to our patients who need them. Move on to the next slide, please. We have had a lot of investment this year in what we call our front door. So in our ED departments, there has been a programme running, which is a regional programme called No More Silos. And over the last year, the investments associated with that programme, which are about £6 million recurrently for ourselves as a trust, are focused on our front door. So, for example, we will be establishing by January this year what we call our minor injuries stream. at Altnagelvin Hospital, and that will effectively, it will expand the footprint of what you would see as our ED, so that some patients can go to a different area and to be treated quickly for more minor aspects of their care that they present with. And there will be just under £2 million invested recurrently in that minor injury stream in Altnagelvin Hospital. We do also have additional work and investment in South West Acute Hospital. We have already established site coordination hubs, and those are focused through a hub at Altnagelvin Hospital, and they meet regularly through the day to look at and to manage better patient flow. We do have a mental health liaison team, and their support for patients in ED were required, but we acknowledge and recognise that this is a very challenging area of service. And we know that where people do require acute treatment in a mental health hospital, it is very difficult to gain access because all of our mental health acute beds are oversubscribed. And then finally, we want to maintain really good resilience in our staffing in our EDs to ensure that patients are triaged, assessed and turned around as quickly as possible. And in particular, we have invested in both Altnagelvin and SWA in nursing and stabilising nursing in our EDs. Next slide, please. The final of the 3 regional priorities is timely hospital discharge for medically fit patients. So really, we've been working very hard to coordinate all of the different disciplines and functions that need to come together through our multidisciplinary teams to plan for particularly a complex discharge. And for our simple discharges, we call them our simple discharges, where there isn't a complex package that is needed, we are now using what we call our discharge lounge at Altnagelvin Hospital, where people can wait if they need to have transport, for example, their families come to pick them up, or they're waiting on their medication or for a final discharge letter. And that will expedite freeing up beds in our wards and ensuring that simple discharges happen more quickly and effectively. We are also enhancing capacity and access to intermediate care beds, and we call them EMI, elderly mentally infirm. So those clients who have particularly dementia, those placements, which are very difficult to secure and scarce within our provision. And we've an expanded number of beds that we've provided for this year in Rectory Fields and in William Street and in Seymour Gardens. And we are working with the independent sector for additional beds for this provision as well. You will be probably familiar with our domiciliary care rota optimisation programme, and that is to make more effective use of the resources that we have for domiciliary care, trying to see more patients and ensuring that unmet need is minimised. And finally, we have been ensuring that our AHP focus on supporting discharge and hospital flow, because we know that those particular disciplines and individuals are very important in planning onward care. Next slide, please. The other areas that I want to talk to you about today, which are equally important to us, but not in the 3 regional priorities, are to start with elective capacity. We know that there's a big challenge to keep elective work going on at a time of very high pressure in our hospitals. And in previous years, we would have seen the cancellation of particularly elective priority patients due to unscheduled pressures and those beds being needed for medical patients. So we are focusing on meeting our what's called our service delivery plan. Those are the targets that the Department of Health set us, and we're doing very well both in our outpatients and our day case, and coming very close to those targets as well in our inpatients. And we want to maintain that over the winter period. You'll know that there have been policy decisions about overnight elective stay centres, one in SWA, and also day procedure units, one in OMA in this geography. And we will continue to build on those and maintain the provision for elective patients in those sites. We're also working very hard to make sure we do as much as we can with the resources that we have. So productivity and efficiency is a big focus over winter. And to ensure that we prioritise the most clinically important patients. We also, move on please, next slide. So in order to give assurance to our corporate management team, our trust board and our public, we do have very close monitoring and reporting as we go through the winter period. We have enhanced monitoring and we do that regionally but also locally, and we have tools like a virtual app, for example, that we as our management team and our front line clinical teams use to see where the pressures are and what work needs done every day. And we also have enhanced escalation processes. When things get very pressurised, people are very clear about the next steps they take to escalate within our hospitals. This year, we also have a new feature in Trust Landscape, and that's called the Regional Coordination Centre. So this is a regional centre that's been set up collaboratively by all trusts, and it will work to look at pressures across the system and to try and manage those pressures across trusts. I think to be realistic in the West, we very rarely get transfers from other trusts, nor are we very easily able to transfer patients from our EDs to other trusts or ambulances from our geography to other trust areas. So this is likely to apply more to other trusts than to our own or in the West. Slide, please. Really important to protect our staff health and well-being, and this is a focus to us at all times, but we know that winter can be a very pressurised period for all of our staff groups. So we do have targeted support for any sickness absence that happens, particularly where there are clusters of that within teams. We have our ongoing health and wellbeing programmes. We like to have a high level of senior management visibility over the winter period, really concentrating on trying to recruit and fill gaps so that there isn't sickness as well as vacancy in some of our very critical teams. And obviously we want to make sure that we protect our staff, and we're promoting the flu and COVID vaccines for that reason. Just the final slide. If you're looking at our website and our winter plan on our website, what I've just stepped through with yourselves is just summarised in a one page. There is a more detailed narrative paper which you can read on our website. And again, I would encourage members to look at the regional plan, which talks about some of the additional investments our department is making in community pharmacy and in the ambulance service, which may be of interest to members. Chair, I'll just close at that, and I'm very happy to take questions then.
No problem. Teresa, thank you very much for a very detailed, I suppose, meeting pack first and foremost that was sent us in advance, which was quite useful.
Thank you.
For reading through, and then obviously for talking to the individual slides and providing direction for us if there's further reading that we want to do around some of the priorities, which is quite useful for us to inform our constituents where we can.
Thank you.
Members, I'm going to open the floor now for some questions if there's any speakers. Councillor McDade.
Thank you, Chair. Thank you for the presentation and for the pack beforehand. It was great. I got a good read through it the other night. And I suppose I already mentioned I'm an employee of the Western Trust, so I know all about the health and wellbeing initiative. And there's a few things I suppose I'm interested to know what the uptake is with the health and wellbeing, because we know that the staffing levels are so low across the board. And I know that I've taken up some of the things that are on offer. So I'm just interested to know what the uptake is, and is there kind of positive feedback from it? I think the discharge lounge is a brilliant idea. I mean, whenever you're in hospital, that kind of waiting for hospital letters and waiting for medication when you could be away home a few hours earlier, and that's a bed empty, is a great idea, and I look forward to seeing that kind of in place. The other thing was you talked about the minor injuries unit, so just wondering what the time frame would be for the minor injuries unit. And just, there's no mention of Western Urgent Care, and I know that's separate, but I'm just interested to know, is there a lot of communication linking up? Because on a personal note, my nephew went to Western Urgent Care, 7-month-old, rang up and wasn't even seen, was told to go to ED and didn't need to go to ED in my opinion and in ED's opinion. So I suppose we know that there's such a bottleneck at ED, but it's not really. ED gets the bad rep about it, but it's not really ED. It's to do with the wards, it's to do with the community, it's to do with all these other systems that are failing in a way. So I'm just wondering, is there much kind of work being done to kind of communicate with the Western Urgent Care to see, can we stop those people being diverted when they maybe don't need to be there? And the last thing was on mental health. I know, I suppose I work in mental health, so I know that there's a lot of patients, well, all patients need to go to A&E for their assessment. And I'm wondering, is there any consideration being given to another safe place as such? Because when you go to ED and there's for a mental health patient, it's quite intimidating and anxiety provoking. So I'm just thinking, is there consideration being given to somewhere else other than that kind of area? But that's it. Thank you very much for your presentation.
Thank you, Councillor McDade. Teresa, if you don't mind, I'm just going to take them in batches of speakers.
That's okay.
And then you can come back and answer a batch of questions together. Kind of keeps us moving on a wee bit. So our next indicated speaker is Councillor Hutton.
Thank you, Chair, and thank you, Teresa, for that presentation. Thanks for coming along. These are very welcome. I suppose what I wanted to maybe hone in a wee bit, I had read the full report last night, and there was just a few wee things that I pulled out from it, and maybe if I could get a wee bit of clarification on them. So I suppose as local reps, we have a duty of care to everybody in our community, and that's the health service, but we also have a duty of care to our constituents. So as Councillor McDade has alluded to about those bottlenecks and about people being referred to the emergency departments when they really don't need to be there, where there's other services that probably could have prevented them going. So there were two wee things that I noticed in the report. One of them was the Phone First service, which has been rolled out in the Belfast Trust, the Greater Belfast area and Arden North Down. And the second one was the Hospital at Home in the Arden North Down area. So upon reading them, correct me if I'm wrong, these are services that do alleviate that bottleneck that Catherine has referred to in emergency departments and out hours, if you can get an appointment in out hours. And it also gives GPs access to other services where they can signpost people into. So my question there is there any plans for these two services being rolled out in the Western Trust? Because they seem very, very useful. They seem as if they would be very impactful as well in relation to people waiting about and waiting maybe 12 and 14 hours and a doctor to ring them back. So as I say, it's maybe that's coming through that regionally coordinated centre, the RCC place. I'm imagining that. But it's a great report. I wish she's well in the winter. As I say, we have a duty of care to everybody, and sometimes we have to maybe be that wee bit more vocal for our constituents and see if there's services that can be brought in that's going to keep them safe and well. But thank you very much, and I wish you the best of luck.
Thank you, Councillor Hutton. Next indicated speaker is Councillor Boggs.
Chair, and thank you very much to Teresa and the rest of the deputation for coming to this. Very, very useful, and like the Chair has alluded to, great to get that information beforehand because there was a lot to stuff through and you've kind of condensed it down. But I suppose mine follows on from Councillor McDade's as well, and particularly in relation to Western Urgent Care. I'm just newly elected in May, but I know the long-standing issues, particularly around Strabane, out of hours care. And in conversations that I've had with Western Urgent Care themselves, they were able to highlight the lack of clinicians willing to take up posts or shifts, particularly in the evenings of the weekdays. And as a result of that, and as a result of lack of funding through the Department of Health, they're now putting their focus on to weekends and public holidays, but there still doesn't seem to be enough. And I think what Councillor Hutton and Councillor McDade have both alluded to is your plan very much spells out the more that we can keep people away from the facilities of hospitals in terms of our big hospital estates, the better for winter. And I suppose that's probably the case at all times, whether we can divert people to pharmacists or on the other avenues. But I suppose my question is quite local in relation to Strabane is, you know, it talks in the bigger report about an extra 3.4 million for general medical services and out of hours. What's that money to improve, I suppose? I mean, I'm not a clinician. I don't pretend to be, but is there anything that can be done, do you think, not just this winter, but I suppose in the long term, to try and get clinicians to fill those posts so that there is a service there in Strabane and in other areas right across the trust area? But just the low uptake, is there anything to solve the low uptake that would then ensure that people aren't being sent to our emergency departments? But like all our councillors here, thank you very, very much. I do not envy your position going into the winter. Just as patients and as representatives, some things that we hear and see are shocking, but you're obviously all working under very, very stressful and budget. Not budget heavy. There is no money in anywhere at the minute, and that's a completely different point. But thank you very, very much for the updates, and if you could provide some clarity on that, thank you. Thanks, Chair.
Thank you, Councillor Boggs. I have two further indicated speakers, but I'm going to allow our guests to address the questions from our first three, first of all. So, Therese, over to you, and then if you want to direct to any of your colleagues, just feel free to, please.
I will do. Thank you very much, and thanks for all of the questions. I'm just going to ask, I'll come to some of the queries first, but just to tee up my colleagues here. Brendan, will you speak about Phone First and anything additional you want to say about GPs and Western Urgent Care, please? Maura, will you cover the hospital at home investment that we have in the northern sector particularly? And if you could also talk about health and wellbeing with our staff. Maura was very involved in some of the work that we did to invest some of the Captain Tom money, so even a little bit about that. We have established, I think, for the first time successfully, a discharge lounge, Councillor McDaid, in Altnagelvin. We have not done the same in South West Acute Hospital because what we call our simple discharge tends to be really quite good in the South West Acute Hospital because it's a very consultant-led service. So the big focus on our discharge lounge is what we call home before lunch. So that the day before discharge, that patients are identified across the hospital who will be made ready for moving to our discharge lounge the next morning as early as possible, hopefully with all of their medication and with their discharge letters. But if not everything is ready, that they can still move to the discharge lounge and have the final elements of their care and discharge processes finished there. So we've had the discharge lounge in place now probably for a couple of months. It's working quite well, and it is a focus for us every morning at the 8:30 meeting. The huddles through the day focus on the patients going into the discharge lounge and making sure we have patients early in the day. So that is working quite well. In terms of your question on the minors injuries unit, we expect that we're doing, so obviously it requires some works at our hospital facility in Altnagelvin, particularly to expand that footprint that we need to take patients through a different stream. And we are expecting to finish the works in around January period, so towards the end of January. And we would hope that we would be, for the first time, taking patients, or less complex patients, streaming them through that pathway in early January. You did ask about mental health as well, Councillor McDaid, and exploring whether there might be another safe place for those sorts of patients. And I just want to say, Chair, that there's been a lot of regional discussion actually on that, not concluded, but ongoing, on the issue of whether or not our acutely mentally unwell patients should stay in ED after a certain period of time. And we, certainly through our Director of Mental Health and Disability, are doing quite a lot of work on trying to explore whether there might be different pathways for those patients where they could have psychiatric input and be in an equally safe place, or in fact probably a place that would be more suitable to their care needs than an ED. Then Councillor Hutton, you talked about bottlenecks and referrals to EDs from our GPs. And there's a big programme of work, particularly by our ambulance service colleagues, which is called Enhanced Clinical Triage. And that is about ensuring, and you'll see it in the regional winter plan, actually, there's been additional investment for that in the ambulance service. And that is to make sure that there are more specialist clinical input in our ambulance service to ensure that decisions are made in a really informed way with patients and with their families about transferring a person to hospital. And if there are other avenues that potentially that patient would be suitable for, that those are fully explored before an automatic journey to ED, a decision for that is taken. So an awful lot of upstream, if we call it, upstream work that's going on, particularly with ambulance service, in our own services, certainly community services with rapid response nursing, and more will talk about acute care at home. So giving acute care in the home setting is really, there's a lot of focus around that at the moment, because we all know how difficult it is to transport an elderly and potentially a person who's confused to a completely different setting and provide care for them, and particularly if that setting is very pressurised. And it can be very, very difficult for those patients and their families. So what I'll do now is I'm going to hand over maybe to Brendan, if you would, Brendan, just talk a little bit about Western Urgent Care and GP referrals. Thank you very much.
Okay, so to start with, one of the things a lot of people don't realise is primary care and out-of-hours care is actually nothing to do with the Western Trust. It's a completely separate organisation. We work with them, but they're completely separate. Now, I do have some positive news for a change due to pension and taxation changes. As a general rule, it tends to be the older, more experienced GPs that cover the out-of-hours shifts. And because that changed earlier in the year, I'm informed that the fill rates have actually increased this winter. So we're expecting the fill rates to be a lot better than they were this time last year. With regards to communication, I was the lead in Galvin ED for 4 years, and we would have quite regular communication with basically DALDOC and all the various organisations, and they would tell us if their shift fill rate is low, we would therefore go out and look for additional doctors in ED. So that would be fairly standard practice. So hopefully that answers your question.
And Brendan, do you want to say something about Phone First as well, which is an operation in the West?
So Phone First, and again, it actually has less impact in emergency departments than people think, for one very simple reason. It's really aimed at people with very minor illness and ailments. So the best way of thinking about that is if lots and lots of people used Phone First, the waiting rooms might be slightly less busy, but the emergency department would never change. Because the emergency department is full of sick people and people who are waiting for admission. So Phone First has no impact whatsoever on those patients. Now, in saying that, it can provide a service of advice and prevent people from coming there. I mean that they're not sitting there for a long period of time. But with regards to emergency department working, it doesn't actually have a big impact. It's more an impact on the patient, and it's good for the patient, and it prevents them from, I suppose, going to the wrong place and waiting a long time to be seen.
Sorry, my question was, is it going to be rolled out in the Western Trust?
Yes.
It is going to be? Right, okay, that's
So
grand.
basically the idea is we're going to have, I think the plans are we're going to have one number for the entirety of Northern Ireland. And actually a lot of the staff that are going to staff the Phone First, a lot of them already work in the GP out of hours as call handlers. So there's a big interaction between the two groups.
So at the moment you can phone a number, but it is a local number. To get that advice. It's called Phone First, I think, locally, and it is staffed by Western Urgent Care Clinical Triage, and they provide advice, and they will direct patients who ring that number. As Brendan says, there is a plan regionally to move to a single service with a single number so that we can get that advice anywhere in Northern Ireland. We'll just hand over to Maura now for the final couple of questions.
Thank you. So if we just take your question first, Councillor Hutton, in terms of our hospital at home. So we do have the hospital at home service within the Derry area. However, it is something we'd like to build on. You will know about the successes that you've read in the report, but it's definitely an area we want to further build on. However, I did want to also say there's a number of other pathways in place also for our vulnerable patients in our nursing homes and our residential homes, and they'll also include, which Teresa's just talked about, the rapid response nursing, also the district nursing team. We're setting up frail elderly clinics, also, which we are very clear that this winter we do need to pay some particular attention to. As well as that, then in the absence of some of the hospital at home and some of the other areas, some of the areas that we're doing is exploring other ways that we can maximise our resource. Teresa said at the outset that a lot of the funding had been in the front door, and there's a lot of the areas that we're looking at is how do we make the best use of what we already have within our areas. And one of those is the care home support team, which we have newly put in place, which is where we're reaching into our nursing homes and those most vulnerable so that we can ensure that we're putting the best support in for our frail elderly. So that's our hospital at home, and it is definitely something that we believe is very useful. Thank you. So then the second question then for yourself, Councillor McDade, was regarding the health and wellbeing of our staff. The health and wellbeing of our staff, we have this big programme called Trust West, which you probably are familiar with, which is a whole plethora of programmes, of which we have particularly around physical activity, nutrition, mental health, and that is offered right throughout the whole of the Trust area in relation to promoting staff health and social wellbeing. Teresa alluded to the health and wellbeing funds, which were available in phase one, was the Captain Tom Fund, which was a number of years ago, where each member of staff got a token of appreciation. The second phase, we have a fund available for groups of staff to actually apply to promote health and wellbeing within the team setting. So that could be small groups or large groups within the divisions or directorates to enable staff to have some time to support their needs and their health and wellbeing. The other piece then that I wanted to touch on was in relation to loss of needs assessments that we do locally. And Catherine, you may well be, or Councillor McDade, you may be aware of that, whereby staff can have bespoke support for particularly those who are working in most vulnerable areas. So there's kind of three key areas that we look in terms of staff health and wellbeing. Okay, thank you.
I'll just finish off by saying, Chair, I'm afraid we can't give you a lot of detail on the investment in general medical services or GP services. I know, Councillor Boggs, you asked about what is the £3.4 million paying for. Our Commissioner does provide local enhanced services which are offered to our GP practices, and there is uptake of those. I wouldn't have the detail of that. I mean, Council could ask for that directly from SPPG if there's, or for a deputation if there's something there that is of interest to you. And I just did want to assure you that as part of how we manage flow, we would regularly communicate with Western Urgent Care, and they would give us, as we go into every weekend, for example, what their fill rates are, so that we would have an idea of whether we might come under additional pressure if the fill rate is poor. So we work closely in that way to try to make sure there's enough cover if there are difficulties or problems with that. Okay, so thank you.
Thank you very much for stage one of your questions. At this point, we go again, as I say in the first indicated speaker this time, is Councillor Devine.
Thanks, Chair. Teresa, thanks very much for your presentation. I appreciate it's a very difficult time for the Trust and it's challenging. I just want to ask about domiciliary care. I represent a rural area and it's an issue that comes up fairly regular, and I know it's particularly challenging and there's a lot of unmet need there at the minute. And I suppose I welcome reading in the report that there is additional funding coming into domiciliary care services to strengthen it. I suppose my question is, what measures are being put in place to try to see how we can improve capacity within domiciliary care, increasing the number of carers, and also to ask just about the early review teams that were to be established. Have they been established at the minute? I also just finally, sorry, I want to welcome the initiative, the Health and Wellbeing Initiative. I think that's very key for staff in a time that's particularly difficult to work in. So thank you.
Thank you, Councillor Devine. Alderman McMorris.
Thank you, Teresa, and the rest of the staff for the presentation. I can all say it's very comprehensive. We welcome you all to the chamber. Most of the speakers, the councillors have already asked most of the questions I was looking just to touch on the domiciliary care just before it was mentioned there. I know there's a bit of a restructure out in the community domiciliary care at the moment, and we're starting to get phone calls already about that. I welcome the early review now that's coming, that'll happen between 6 to 8 weeks, and hopefully that will free up a lot of that rehabilitation domiciliary care, you know, so that it alleviates bed blocking and gets people back out into the community where they need to be. So if you can maybe just touch on what your expectations is of the restructure within domiciliary care at the minute, and how that you hope that impacts within your own system. The other thing I just wanted to touch on too, and other people have alluded to, is the GPs. We know we talked about GP referrals, but everybody in this chamber, I'm sure, gets a phone call every single day of the week in regards to being able to access GP services. And I'd just like to hear from yourselves now how that is impacting, because as far as I'm concerned, a lot of people that I'm talking to on a day and daily basis, they're presenting in the ED as opposed to being able to access the services within the community. So I'd just like to hear a wee bit about that. And I suppose the other thing I'd like to touch on, and it impacts the mental health, and I know we've talked about it, but what I would like to ask is, like, whenever I had an experience where I took a family member who has dementia to the ED, it was a traumatic experience where there's a lot of, and they need the care, and I'm not saying that they don't or whatever, but I just think that you know, having a separate lounge for the people that with mental health, you know, it could alleviate stresses within the other EMA patients, because they find it very difficult with the crowds and stuff, and just sometimes the behaviour. And the fact that every time you go to Eltnagavin, you can see 4 or 5 police there, do you know what I mean? And I just think that there needs to be a wee bit of work in regards to maybe having a safe space for them kind of patients where the police can be there, and maybe that can alleviate the need for so much staff or whatever. I mean, I don't know. I'd just like to see what your take is on it. Thank you very much.
Thank you, Alderman McMorris. Councillor Duffy? Sandra Duffy, sorry.
Me, yep, thank you. Thank you, Teresa, Brenton and Maura, for your presentations. I don't actually have a question for you, but I just want to make a comment because you're here. And it's just in terms of the support that we have for all the staff who work within the Western Trust and the work that they do, be it from admin to social workers to our nursing staff and doctors and everyone in between, who are all working in extremely difficult circumstances. We see at times the Health Trust coming under attack and negativity around some of the issues, and it's probably around getting access at times through primary care. But I have to say, in terms of once you get access and you're through to acute care, the service that we get through the NHS here, and particularly through the Western Trust, is second to none, and my own personal experience would bear that out. But I want to also comment on the fact that there is industrial action that is currently ongoing, and we have been on picket lines with nursing staff, with junior doctors, with radiographers, with the ambulance staff. And the message is very clear that they need fair pay and safe staffing levels. We have had conversations, and it's around the retention of staff as well. And these are really, really good staff that we have who are going elsewhere because they are getting better paying conditions. And we are losing absolutely fabulous talent that we have within the Western Trust. So I just want to put on record our support for the industrial action. We want to see it resolved, and we want to see people paid an equitable rate and have safe staffing levels to do their jobs. But again, my own personal thanks in terms of the work that goes on day in, day out within the Western Trust, and just want to relay that back to the staff within the Trust. So thank you.
Thank you, Councillor Duffy. And we're going to pause there and allow your name. So I have 3 further on the case. We want to allow our guest first of all to answer that batch, Gary, if you don't mind. So back to yourself, Teresa.
Okay, thank you. And first of all, just to thank Councillor Duffy for the remarks and the support for staff. We do have the additional challenge of managing periods of industrial action and ongoing non-continuous industrial action over the winter period. And if it's not challenging enough, that's another one that we all have to try to manage, and manage respectfully. as well for our staff. But thank you for the comments. In terms of domiciliary care, I'm going to ask Maura to talk about the road optimisation work that is underway. But just in overall terms, as the Director of Performance in the Trust, we are meeting all of our unmet need targets, which are set for us by the Department of Health, and that is to reduce the level of unmet need in the Trust month on month. And I can confirm that we are meeting those targets, but Maura will talk about the part of the how we are doing that and the particularly the steps that we're taking. And Maura, would you talk about the early review team as well? I have to say that access to GPs and GP services, our primary care colleagues, does come up time and time again as Alderman McMorris, as we meet councils and as we meet our elected representatives. We as a trust have been asked to take over the management of a number of GP practices, as I'm sure council members will be aware. And that is because that we have been essentially the organisation of last resort to try to take on practices rather than those patients be dispersed by other practices and put more pressure on other practices around, particularly the Western area. So that's been a very difficult ask for us, and I think we all know that our primary care system is under a great deal of pressure. I don't feel well qualified to talk about access to primary care. I think you would need to have our colleagues in SPPG talk about that. Brenton could say something at the end if he wishes to, in terms of who comes to our emergency department. And whether we've had a big swing in people who could be seen by GPs, but the vast majority of people that we deal with and who present to our emergency department are very acutely unwell. So I think we'd want to say that. So and maybe the final comment from me, just to acknowledge the comments that were made by Alderman McMorris about the difficult setting that we have for dementia patients in any ED. Not just Altnagelvin ED, any ED. In particular, I want to just mention the work that we've done to create a quiet room for particularly our learning disabled people who attend ED, particularly those with autism and sensory difficulties. And that has been a good development, which was actually put in place last year and is in Altnagelvin and in the South West Acute Hospital. But I suppose in overall terms, we have a very small ED in Altnagelvin. We have a big programme of capital development. Part of that is a huge expansion in our ED. That will require the investment to take that forward, and it'll be a long time, once we get that investment. So that is something which we very much want, but will be some years into the future, unfortunately. So I'm just going to go back to Maura now, if that's okay, Maura. Mm-hmm.
Thank you. So the first piece I'm going to look at is the early review and assessment team on your question, Alderman McMorris. And it has been in place since October 2023, and it's been in around a month now. And as you say, what this does is we look at the packages which have been in 6 weeks or more. And so what that enables is that sometimes when someone's coming out of hospital, they would have quite a high package of care and may no longer need it as they, get better as they come out into their homes. So that gives us the opportunity to look to see if we still need that package of care or maybe that enhancement that has already been given. So it means that we can then look at the additional capacity to where it's best needed. So it is in place at this moment in time. So the second point then, which you'd asked me to speak to, is the domiciliary care and the measures that we're putting in place. So Teresa alluded to the difficulties that we've had over the last while, particularly in relation to industrial action, and also the difficulty even within the environment in terms of attracting carers to domiciliary care. However, within the Trust, we're working really closely together in terms of what we call rota optimisation. And what that means is that we are prioritising those that are most in need. But along with that, the steps that we're taking is that we have a team internally called our brokerage team and our social workers who work together to look at how you make the best out of your rota. So you're not going to have a carer going from one side of the country to the other, one side of town to the other, that for the most part that you are having people travelling within that particular area, again, to make the most of the capacity that we have. We are going live on Monday, the 20th, in the water side. So again, a huge amount of preparatory work goes into that to allow our social workers and our domiciliary and our carers to actually how would you say, to be prepared for that change. And you did allude to that as well earlier on. So it's going very well for us at the moment. It means that we are using the best of the capacity that's available to us. However, we've a lot more work to do in this space as well. So that's really the road to optimisation. And then I also did want to say that the teams that we have at the moment into the winter, really when individuals are in hospital and they're getting a package of care, that we are how would you say, aligning the need that they have to the road to optimisation as you go back out into their home. Is that okay? Is there anything else that, okay?
Okay, I'll just maybe Brenton, anything about people.
Yeah, so I suppose it is reasonable to say primary care, they've got their own staffing problems and capacity problems. The workforce is getting older. We're getting retirements. People aren't being replaced. So primary care is struggling, to be fair to them as well. Now, to be honest, if you actually look at the patients that wait in the emergency department, they're all sick. They're all waiting for admission. That's not the primary care population. If they had been seen by a GP, they'd be referred to the emergency department. We would see them, we would admit them anyway. So probably doesn't affect that much. One of the things to remember as well, in an emergency department, we triage every patient that comes through the door. So basically the sickest will always be seen first. You know, that's really what an emergency department is there for. The flip side of that means if you do come in with quite a minor condition, unfortunately your waiting time is not going to be good, or with a minor injury at a busy time. That's one of the reasons that we're basically focusing on getting a minor injury stream as well. Because, you know, if you come in with a sore wrist or sore ankle, there's no reason that you should be there for hours. The problem is if all our cubicles are filled with unwell people waiting for admission, we physically have nowhere to see you. So that's why we want this separate area that we can rapidly see people. And, you know, it's good for staff as well, because it's really not nice sitting working in a department where you actually don't have any physical space to see patients. That's horrible for everyone, staff and patients.
Thank you for that. So we'll go again. And the first indicated speaker this time is Councillor Donnelly.
Chair, and I'd like to thank you for being here. There is a lot of, I suppose I have a number of comments to make rather than questions. A lot of what I could have said has already been said by colleagues here. There is a frustration amongst a lot of people, and it's, you know, multi-pronged. It could be regarding access to GPs. I'm sure we've all heard it. It could be, and I've witnessed myself, people, you know, who were waiting in an ambulance, hours. An elderly woman lying on the ground in the rain with believed to be a broken shoulder. People in home, mental health problems, and these and others. You know, people were waiting for hours for an ambulance, and it can be frustrating. Not everybody is able to identify, you know, the reasons why there may be such a delay. I've heard, you know, some difficult reports in the last number of weeks of people who were waiting, and it's not counted in hours anymore. And you know, in hospital or waiting in the A&E, it's not A&E anymore, but it's going into days rather than hours, particularly for maybe mental health issues. You know, some of the stuff has been touched on regards dementia and safe spaces, and I would echo that too regarding maybe children, you know, on ASD, you know, and issues like that. Councillor Duffy has pointed out about the you know, staff retention and pay and conditions. I think that, you know, there is something badly wrong here, and again, fully support the workers, and I'd like to pay tribute to the work that you are doing and people in the trust are doing. But that frustration is out there, and people can lash out, or they can put the blame where it shouldn't be put. But hopefully, some of these measures can go in some way of dealing or making that a bit more less difficult. But I think there needs to be something really more fundamental and deeper if we were to get the health service fit for purpose, that people aren't waiting getting in 90 days, or people aren't lying on the streets waiting in ambulances in the rain. But again, I'd like to pay tribute to you and thank you for being here and doing this presentation. Thank you.
Thank you, Councillor Donnelly. Councillor Jason Barr.
Thank you, Chair. And again, thanks to Teresa and the team for coming in today to giving us a very productive presentation. It's great to see some positivity coming out of the presentation, especially for a department that's under so much pressure. Now, my concerns are a wee bit more morbid for my other side of my life. I'm an undertaker. So it's just some concerns that I have that we would experience, particularly at this time of year. One of them would be access to death certificate. So on many occasions coming into the winter time, we would find, I can recall one last year, where somebody would passed away at 8 p.m. in the evening, and by 12 noon the next day there's still no death certificate issued. And no, families are ringing, obviously quite concerned. They want the family member home for the wake or whatever. So it's just I don't know if you can put pressure on doctors to maybe sign a wee bit quicker, or how that works, or what way it goes through the department to maybe speed that up. The other one is communication. And I know this probably is more concerned with primary care, but it's the fall down of communication on evenings and weekends when it becomes to police contacting a doctor. Now, somebody could be ill, but die suddenly, if that makes sense. And then they're transported to Belfast because the police can't get in contact with the doctor. And then they're sitting in the forensic mortuary in Belfast for which could be up to 24 hours. And then we get a phone call to come up the road, then to remove them back home when there's no post-mortem required. And it's just unnecessary time wasting, to be honest. And in fact, and to me, if there was better communication, where if the police could phone someone in the department just to say, we'd like to know has this person been ill? Yes. Okay. Do you feel that there would be a need for a post-mortem? No. That would just cut out that whole process in between. So sorry for the morbid stuff there, but it's just questions that I feel concerns that need raised. But again, thanks very much for your time. Thank you.
Thank you, Councillor Barr. And just before we go back, I have a few questions myself that I would like to throw into the mix as well. I have read through the report, as I've already said, and I think the introduction of the minor injuries stream is something that will benefit not only people who are visiting the ED having to wait long hours, but will also benefit your staff as well. And should, you would imagine and hope that in terms of staff morale within the ED department would be a major boost for them. So we look forward to seeing the rollout of that. And a lot of what's in the report and even within the presentation, as Teresa was speaking, it was about taking the pressure off hospital staff and trying to run services better. One of the programmes which I think was quite successfully rolled out was the neighbourhood nursing programme, which did take a lot of pressure off staff. So I would like to know, is there any further plans to roll out other teams of neighbourhood nursing staff across the Derry and Strabane area? Because I believe that we have seen the benefit of that particular programme, and I would like to see it roll out better. There's also, I had been contacted by a member of staff who was interested in the Twist West programme, who'd just been diagnosed with a medical condition, and for their own mental health were interested in taking up a few of the programmes. A lot of the programmes were run 9 to 5 during the working day, and particularly some at lunchtime. And you will know better than I do the pressures that your staff are working under, how many days a week frontline staff in particular are not getting a lunch break. And then for these programmes to be scheduled during their working day is only adding further pressure, and it isn't really beneficial to them to be out of their work and realise that their patients are being left and they're leaving their colleagues and under even more pressure. So is there allowances for frontline staff who are looking to attend the Twist West programme, although it's during their working hours? And if there is, how do they go about accessing that? Because I think that's really, really good. if they could. I also just, on a further comment, and I know you've already addressed it between Councillor Duffy and Councillor Donnelly has addressed it as well, around the industrial action. I, like many others in this room, have been on picket lines and will continue to support nursing staff and frontline staff if they do have further industrial action. I know it's not the fault of the trust, and there's further up that have, in my opinion, a moral responsibility to meet the demands of staff. But I'm keen to hear, because I hear it from the staff when we're on the picket line, but I'm keen to hear from a trust perspective around the staff morale around those particular issues, because it can't be good if you are continuously working in busy wards with not the appropriate level of staff there. And, you know, I touched earlier on in relation to staff having to work through breaks, work on later than they're scheduled to work on and stuff like that. So I would just like to hear from your perspective around the staff morale around those particular industrial action issues as well. Thank you.
Thank you, Chair. I'm going to ask Brendan to deal with Councillor Barr's comments around access to death certificate, etc. If it well outstrips my area of knowledge, so Brendan would be happy to take that area. In terms of your question, Chair, on neighbourhood nursing, that was a very significant investment associated with the complementary investment in multidisciplinary teams in our GP practices, as you know. Money is extremely tight at the moment, particularly money to develop new services. So there has been nothing at this point in time in terms of additionality for that very, very good initiative. Very much driven by our Chief Nursing Officer as a key development on community nursing, but I can't report anything positive in terms of any further rollout or further investment in that at this point in time. Very happy to take back your comments about Twist West and the access to programmes during the working day and more flexibility in that for any of our staff. Many of these programmes are self-referral programmes. It doesn't require, you know, occupational health to refer or a manager to refer. So, I mean, we would have an expectation that managers would support staff if they're in a conversation with their staff about pressures and stresses and their health and well-being at work. So it would be an expectation of ours that manager and member of staff would work together to give release. I couldn't tell you off the top of my head whether that's enshrined in any policy document, Chair, but it's kind of how we expect people to work. But I certainly will feed back the flexibility issue, and indeed a lot of our programmes now, we also have additional e-learning programmes, which obviously can be done at any point if a member of staff wants to do that. Brenton, I'm going to come to you now and then come back to me on the staff morale issue, if that's okay. Thank you.
So with regards to the coroner requires that a doctor has to have seen the patient alive. Now, the reality is, if it's out of hours, it depends on how many doctors are on that shift. As a generalisation, the bigger the hospital, the more likely it is that a doctor will have seen the patient at some point when they're admitted. But in some of the smaller hospitals, and sometimes after midnight, it may well be that there simply is no one there who can legally sign the certificate. We're not allowed to vary that. That's just the way it is, unfortunately. Now, as a general rule, we do all try our best because it's quite distressing for a family if a body hasn't been released. Moving on to what you talked about, kind of the deaths outside a hospital, that's not a hospital issue. That typically that would have been covered by GP out of hours, but the problem is they're also constrained by the regulations. If they haven't seen the patient within a set period of time, from memory, I think it's about 30 days, they're actually obliged to discuss the case with the coroner. So it's legislative change rather than people deciding, if that makes sense. And I'll maybe just go back a little bit as well, just the comments that Councillor Donnelly made about the mental health bed weights, and you're absolutely correct. You know, things have deteriorated quite significantly. it's really been happening over about the past 18 months. Things have changed, so I'm not sure if it's due to just a general increase in demand or if it's a post-COVID change, but there has definitely been a change, and we now would have routinely quite prolonged waits due to patients with mental health problems who, to be honest, require admission. You know, now all the mental health beds are full. They generally run at 110 to 115% capacity. So they've actually got more patients in the units than they're designed for. We've asked the mental health team, is there any different working patterns they can do? Are there any patients they could care for from home, like a hybrid working? Basically, is there anything different that they could do? So they're looking at all the possibilities. Unfortunately, Councillor Donnelly, I'd say being within emergency medicine, it's something that has happened all across Northern Ireland within the last kind of 1 to 2 years. It has definitely changed. Whereas previous to that, it actually wasn't much of an issue.
Just finished, Chair, just to respond to your final point about our perspective on staff morale. We all know how difficult the environment is financially, and we're all very aware of the fact that we do not have a pay award for our staff for this year, while other parts of the UK do. I mean, I can't say how much or how little impact that has on staff morale, but I think we could all say that it's in the round. It's bound to have an impact on our staff in terms of how valued they feel. That's not, you know, a trust perspective overall. I think that's just probably a reality that we would all just recognise. We do have a bit of a mantra in our team, and that is really around making sure that we improve and manage and control the things we can control. Because no trust can make a pay award. That is a matter for our department. So the things that we are really focusing on and have been focusing on for really the last 18 months are things like ensuring that we have the appropriate levels of staffing throughout our services, not just in our hospitals. And we have a big programme called Workforce Stabilisation, which stretches across a whole range of disciplines: nursing, AHPs, social work, and into our medical workforce. And we have a whole range of ways that we are working to improve the stabilisation of our workforce, including health and wellbeing support, absence management, changing our recruitment processes to ensure that we recruit much more quickly and we have people in jobs much more quickly once they are recruited. One of the other things that I think has been very important for us, and it actually has been a regional initiative, has been the work that we have done in nursing to drive down the use of what we call off-contract agency nurses. And these are nurses who, for the last number of years, have been in particularly our hospitals, but have been, I suppose, benefiting from rates of pay, which are just about a market force. They are off contract, and I think it's fair to say that within environments where you are working alongside a person who is paid sometimes a great deal more than you, it can be demotivating and certainly something that you would expect your employer to do something about. So we have very successfully across all trusts been managing moving away from the use of off-contract high-cost agency staff, bringing more and more work onto contracted agency and actually into our mainstream workforce. So those, I think, Chair, are two things that I would want to say we are trying to do within our control to make the working lives of our staff better and to make their experience at work better. Thank you very much.
Thank you, Teresa, Maura and Brendan, for your attendance here today and your attention to detail, I suppose, around some of the concerns that have been raised by elected members. We, as a committee, wish you and all of your teams and all of your staff very well heading into what we anticipate is going to be a very difficult winter for everyone. But we will do all that we can as a council and as elected representatives to support you in any way that we can. And if there is anything that you feel that this committee or this council can do to support you or your staff, please don't hesitate to get in contact with us. And thank you once again for your attendance here today. Thank you.
Thanks for their support. Thank you.
Thank you. Thank you. Members, we'll just give it 5 minutes, all right? we're back at it here. Settle down. Next item of business is chairperson's business. I've only one person who's contacted me on an issue, Councillor Duffy. I'll bring you in a wee second, Councillor Duffy. I just want to comment on the tour that we had today of City Baths, which I think was absolutely fantastic. For me, it was really, really good to get back into the building to see it. And hopefully very, very soon we see all of our user groups using that much loved facility in the heart of the Bogside. I want to pay tribute to the staff from this department, from E&R and from our capital team and from right across council who've worked so hard under very difficult financial pressures to make sure that everything was done to get that building open and operational. And as I say, hopefully it's not too long before we see the public enjoying such a much loved facility. So thank you all very much. Councillor Duffy, on a chairperson business.
Yep. I'll be really brief. It's just a request of deputation. Last year, I had a lot of contact with the Northwest Islamic Association and was very privileged to get an insight into the work that they do within the wider community. And they have since I actually suggested to them last year that they should contact the committee to come in and do a presentation in terms of all the work that they do. They have since come back to me to say that they need a proposer through the committee, so I agreed to do it. So my proposal is that we add the Northwest Islamic Association to our list of deputations going forward. Thank you.
Thank you, Councillor Duffy. Councillor Donnelly?
I'll second that proposal, Chair. It needs a seconder.
No worries. So that's proposed by Councillor Duffy, seconded by Councillor Donnelly. Everybody in agreement? Yeah. Okay, Councillor Duffy, that'll be added on to the list. And hopefully we get them in the not too distant future. Item number 7 then, moving on, is the matters arising from the open minutes of this committee held on Thursday, the 12th of October, pages 33 to 44. Can I get any matters arising? No? Okay. Item number 8 then, members, is the dog control work plan and enforcement policy, and I'm assuming that's you, Seamus, yeah?
Thanks, Chair. Members, the report outlines the functions of the Dog Control Service and the regulations and orders that assist Council to deliver the service. Council is also required to provide DAERA with statistical information on the Dog Control Service areas, and these are outlined in Appendix 1. Members, the primary objective of the service is to promote responsible dog ownership through education and enforcement activities, and these are outlined in the draft plan in Appendix 2. The enforcement policy outlined in Appendix 3 outlines the proportionate actions which all the dog wardens will take in relation to the service delivery. And members recommend that the committee approve the Dog Control Service plan and enforcement policy.
Thank you for that. Seamus, Councillor Hutton.
Thank you, Seamus, for that report. Do you know, I just wanted to ask a question. It was something that jumped out at me when I was reading it. Throughout my work as a councillor in my constituency, I'm constantly getting reports of dog fouling in and around the areas that I represent. I've been working very closely with you, Seamus, and Kelvin has been amazing. Dog bins have been put in areas where it's going to try and alleviate some of that issue, right? But what jumped out at me in that report was the fact that from April to September 2023, there was only 3 fixed penalty notices given out for dog fouling. So my question is, why is there not more when the streets are absolutely covered in it day in, day out? And the council are coming out and cleaning it. I'm not saying that it's not been cleaned. It is. But I can't understand how there's only 3 fixed penalty notices. So for me, I'm asking you, how is it that somebody's fined? What is the process? What evidence has to be given in? Or, in your opinion, is it stray dogs?
Through the Chair, Councillor Hutton, it's a difficult one, and I suppose this question gets raised at this committee every year whenever we bring in the draft plan. In summary, we have to witness the offence. The wardens do carry out proactive and reactive patrols when we receive complaints about dogfiling. And in some instances, but very few, we would witness the offence and issue the fixed penalty. The difficulty is and it goes back to responsible dog ownership. Some owners let their dogs out late at night, early morning, and then it's the next morning where we get complaints about dogfiling. So it is a difficult one to tackle, but we're trying to educate and enforce at the same time. So we would go into the schools and try and promote responsible dog ownership with the young children so that they can relay that message to their parents or the dog owners. So we will continue, and we do plot all the areas where the dog wardens carry out proactive patrols so that we can bring in a report to committee should members wish to get that information in terms of are these areas covered. But it is a difficult one to crack, and all councils are experiencing the same problem.
All right, just one last question. I don't want to dwell on this too much. So you have to witness the fouling, or can a member of the public witness it and provide you with evidence of an owner watching a dog do it? Am I right in saying that? People are asking me these questions, so I want to get the answers to them.
That's correct, Councillor.
Is it?
Yes, if we obtain a witness statement and the information is accurate and we're happy enough to bring, should they fail to pay the fixed penalty, we then would proceed for a prosecution. So if that witness statement is adequate, we would be happy enough to issue the fixed penalty.
Thanks very much, Seamus.
All right, Councillor Hutton, thanks for that. Next on the same topic is Councillor Lillian Sinoy Bar online.
Thank you, Chair, and thank you, Seamus, for the report. I welcome the Council's proactive stand in regulating and enforcing legal duties, and the emphasis on responsible dog ownership through both education and enforcement is also a very significant step. The persistent issue of dog falling in our city and district is alarming, and I welcome your comments about council's proactive in that issue. And also, just to echo Councillor Houghton's comments, I am sure every elected member has received a phone call or has been stopped by members of the public about dog falling. And section 2.12 of the report suggests a reactive nature in our current approach. And I think we need a shift towards a more proactive and preventative strategy, and not just about promoting responsible dog ownership, but also highlighting the health hazards associated with dog falling. There's also specific concerns about dog being off leash in areas like Brook Park, despite clear signage and potential fines even included in the clear signage. And I wonder if our park wardens effectively monitor these areas, especially during big peak times. There are also concerns about dog waste bins, and like Councillor Houghton, I think I've notoriously contacted council about this issue. Well, the efforts to place additional dog waste bins is commendable. I wonder whether a comprehensive assessment has been conducted to identify areas in need throughout the city and district. I remember contacting council officers just as soon as we were elected, particularly on this issue, because it was one issue that has been coming up day in, day out throughout our election and even after. And I want to thank Kevin particularly for being very proactive. I know that he did an assessment through in Foyle Springs Road, but since then I have been contacted by residents across the city, people from Chantalo, even as far as Traban, just asking about dog waste bins in their areas. I think there is an issue that we need to address there. And if we implement education and raise awareness, and the infrastructures to support those policies are not in place, then we're not going to succeed. And I will be bringing a motion to council to really look at a more targeted approach and collaboration with Dog Trust NI and other similar organizations, specifically on dog falling. But thank you for the report, and I am happy to propose it.
Thank you, Councillor Barr. And just on that, Councillor Hutton has seconded the recommendation within the report for the thoughts there. Councillor McDade.
Very quickly, just I just wondered, is it the job of, because I can't get to the bottom of this, is it the job of the dog wardens when it comes to dog breeders? So if somebody seems to be starting to breed at home, so it's then causing nuisance, which I'll come to in the later report about sound and noise nuisance. But, you know, if someone started 2 dogs and started breeding them, so now we have 10 dogs dirtying and barking and everything else in a detached or in a semi-detached house, is that the dog warden we should be contacting? Not, I know obviously when it comes to the dog's dirt and that, but if there's a thought this person doesn't have a license, do they need a license to breed dogs? And how do we check if they have a license? And then what's the enforcement if they don't have a license? Thank you. It's a very specific case, I'm sure you can imagine.
Through you, Chair, yes, Councillor McDade, dog breeding establishments should obtain a licence from council. There is specific criteria in terms of the number of breeding bitches and the number of litters, but happy enough to follow up on the query that you have.
Thank you for that. Councillor Donnelly.
Chair. Look, since I've come into this council, dog fouling has been a major problem. Well, it's been a problem long before that, but the point I'm trying to say is that we've spent a lot of time on here, and we've had all sorts of proposals from mobile CCTV, the Councillor Gallagher's DNA database. I don't know what the answer is, but I have to agree with previous speakers. It's a huge problem. Look, it's just regards the licensing and the chipping. I'm not sure, the requirement for both to have a license and to have your dog chipped. There has been some people who've asked me, why is that the case? Would one be sufficient and why do we have 2? I don't have the answer to that. Maybe it could be. But is there, I'm not sure how many dogs are licensed or chipped in the council area, but would it be an idea of sending them out information? Each person who has, or from here on, giving them information regarding the dangers and regarding dog fouling and being encouraging them to be a responsible pet owner. Maybe that's happening. And then you also have the angle that, not everybody, maybe the people that's responsible for this, probably there's a possibility they may not have their dog licensed or chipped. I'm not sure. Can you enlighten me on any of that? Thank you.
Councillor Donnelly, I'll try and start off with the licensing side of things. So council have approximately 9,000 dogs licensed, which is a dramatic increase from when the new council was formed. We continue to issue literature to all dog owners that have a dog license, and it is a requirement to have a dog microchip before you get a license. So we will continue issuing the information in relation to responsible dog ownership, and we do that probably on an annual basis because the license has to be renewed on an annual basis. And if we have concerns about a particular area, we would do a search for all the licensed dog owners and issue literature in terms of dog fouling or straying in relation to that. So it's a difficult one. We will continue. We do have the CCTV cameras, as you mentioned, and we continue to use them in accordance with the policy. And there had been previous reports brought to committee in relation to some of those other matters, and we will continue to keep them under review.
You, Seamus. Alderman McMorris.
Thank you, Seamus. Just a quick question. In regards to the free space that people can go and walk their dogs, or not walk them, let them off the lead. I know that that's part of the, that you're looking into, but I know previously there was talk about maybe one in Dermaho. Has council done anything actively to get spaces, I guess? Because I'm sure if there was spaces, I guess, here, it would ease a lot of tension for like people that's scared of dogs in public places and stuff. If they had somewhere where they can just let them off the lead and pant out their energy or whatever.
Yeah, Councillor McMorris, there is a cross-departmental working group considering the dog parks, and the dog control service are linking in to that as well. But it's important to note the key here is having a dog under control. So the dog control orders in relation to dogs on or off leads apply to the majority of the parks. And the key is that when a dog's on the footpath, that the dog owner has it under control. So a report will be brought back into committee in relation to scoping out the dog parks within the council area.
Thanks for that, Seamus. Seamus, just before we move on, a number of years ago, people will remember council went under an agreement with a local rehoming charity around taking over the kennels at Pennyburn. I've been made aware of a number of social media posts in recent weeks that state that that charity is no longer in a position to continue that service through a volunteer base due to some issues within their own organisation. Have you been contacted by the charity to inform you that they're going to cease providing that service? And if so, what steps will council take to ensure that a service is still there for stray dogs or for rehoming or such like?
Chair, yeah, we haven't received any formal notification in relation to vacating the kennels or terminating the lease. The first I became aware of it was the Facebook post, which is probably the same that you're referring to. So I did contact Pet FBA and received reassurance that they do intend continuing with the lease. Council had entered into a lease agreement for 3 years, which is due for renewal, I think, in April. So we'll continue liaising with Pet FBA, iron out any difficulties that they have. My understanding is they have no difficulties with the lease agreement at this stage, but we'll bring a report back into committee in terms of that future lease agreement.
Okay, thanks for that, Seamus, but it's fair to say that that service will continue for the foreseeable future, and if not, we will be notified.
That's correct.
Yeah. All right. Okay. Thanks for that, Seamus. Members, item number 9 is local air quality management, and Seamus, I'm presuming that's you again. Yeah.
Yes, Chair. The report outlines the legislative framework relating to improving air quality within the council area. So each year, council submits an application for funding to operate and maintain a network of air quality monitoring stations across the council area. The application submitted this year also sought funding for a new monitoring station in Castlederg, and that's to monitor pollutants associated with burning of fossil or solid fuel. Members, the letter of offer outlined in Appendix 1 has been amended, and the level of funding awarded is now 78,000 rather than 69. And that's largely due to council obtaining 100% capital costs for the new monitor in Castlederg and the portable monitor at John Clifford Bull Park. Council does have to contribute to the running costs, which can be met within existing budgets. And the recommendation, members, is that you approve the letter of offer from DERA for continued air quality monitoring and the purchase of new equipment.
Thank you, Seamus. Councillor Devine.
Thanks, Chair. I'd just like to welcome the funding from DERA to enable us to monitor air quality here in the council area, and also to welcome the establishment of the new station in Castlederg. Air pollutants obviously can have a serious long-term effect on our health and also on our environment. So it's important that we are informed about the quality of our air to ensure that we're breathing, the air we breathe is safe. So I'm happy to propose recommendations.
Thank you, Councillor Devine. Alderman McMorris, happy to second? Yep, okay. No further speakers? No, thank you for that. Item 10 is the age-friendly strategy and action plan. Barry?
Thank you, Chair. Members, the purpose is to seek your approval for the formal adoption of the age-friendly strategy and action plan for the council area. The strategy and action plan it's a 3-year plan that seeks to provide the framework to ensure the council is an age-friendly city and community where older people are supported through life's journey so they continue to be respected, involved, independent, fulfilled and treasured later in life. In the key issues section, members, you'll see key to the development of this strategy has been the involvement of older people in the co-design and co-production of the strategy and action plan. Working alongside council, the consultancy team established a co-design steering group with nominations for an older person's representative received from each of the 8 local growth partnerships, in addition to developing Health Communities, Northwest Community Network, the Forum for Ageing Better and Rapid. The co-design steering group was tasked with identifying and engaging older people to ensure their active participation as part of the development of the strategy for the council area. Feedback from the public consultation has been considered as part of the enclosed strategy and action plan for your consideration. The action plan in your Appendix A contains 4 cross-cutting themes and 4 outcomes, outlined in 18 actions in total. And that will enable the Age Friendly Alliance members and all stakeholders to work towards the aspirations set out in the overall strategy. With regards to cost, members, the costs for the strategy development were contained within grant funding received from PHA and support from council. There's no additional costs associated with this element. Further discussions have commenced with the partners of the Age Friendly Alliance to identify partnership approaches and resources to progress the implementation of the strategy and action plan. And key to the delivery of and implementation of this will be the continued partnership working between council, statutory agencies and the C&V sector. So in terms of the recommendation, members, that you approve and endorse the Age Friendly Strategy and Action Plan for the council area. Thank you, Chair.
Thank you, Barry. Councillor Duffy, Sandra Duffy.
Yep. Thank you, Chair, and thank you, Barry, for the report. And I'm happy to propose the strategy, and I want to put on record our thanks to Ciara Burke and a lot of the work that she has been involved in relation to this. I want to just particularly comment on 2.1 of the report in terms of supporting older people throughout their journey so they continue to be respected, involved, independent, fulfilled and treasured in later life. I just think that that's it in a nutshell. Last year, I had the privilege of doing a lot of work with older people, and Ciara was to the fore of a lot of that and setting up meetings. But one of the things I really enjoyed was getting out around the community, seeing the work that was already going on through deeds, through memory tea dances, through luncheon clubs and different events. And I think it's really important that we as a council recognise a lot of that work, enter into those partnerships and do help older people as they age in our communities, and they are allowed to live well for longer. And I think that's the key to it all. And we are all aging from the minute we are born. So I know you're shaking your head, Brian. I don't know about that. No, so I think it's really important, and probably as I head past the mid-40s and into the 50s, I think the strategy is really good, and I welcome it today. I think some of the stuff that's involved in it is great, but some of the stuff that's already going on in our communities just has to be welcomed, and thank people for the work that they do.
Thank you for that, Councillor Duffy. Just for the minutes, did you say head past or well past the mid-40s? Just for the minutes.
Still mid-40s for the record.
Councillor McDade and then Councillor Donnelly.
Thank you, Chair. I'm happy to second it as well. Just to recognise it's a great report, and I think I agree with everything that Councillor Duffy is saying. You know, we have to do everything we can to support people as they're getting older and keep people. I think it actually links back to the deputation as well. You know, we're trying to keep people at home and care for people at home, and you know, we know that if an older person goes into hospital, they're more likely to deteriorate quicker and unfortunately die. So actually, if we can keep people on sorry to bring it down again, but you know, like if we can keep people in the community and happy in the community and have a good quality of life, we should be doing everything we can. Thank you.
Very morbid over in that corner of the day. Now for Dr. Death, Councillor Donnelly.
Well, good Chair, and Chair, I think Councillor Duffy declared an interest in, just in a different way, you know. But no, look, I think, our elders are, they laid the current foundations and they've guided us each individually. And, we all look up to be a grandmother or mother and that. So I think it's just important that we do everything we can and a bit of respect and a bit of payback. So just happy to endorse the report here. Thank you.
Thank you, Councillor Donnelly. Alderman McMorris.
Thank you, Chair. I'm going to be brief. I also would like to welcome this strategy. As a person who nurses my elderly mother, I recognise the good work it goes on in the communities to ensure that our older people not only are not socially isolated, but also they're engaging and living a full and fruitful life. So this is really welcomed, and well done to everybody involved. Thank you.
Thank you, Alderman McMorris. Councillor Jason Barr.
I'll also just be brief, just to welcome the report also, and I look forward to seeing this rolled out. But it's just to give a wee mention to the Dennett Interchange Group and Brighter Ballymagorry Development Group, who recently won runners-up in the Age Friendly Initiative at the IBP Pride of Place Awards for their Care 50 Plus project. So I'll just tie that in with that to congratulate them also for recently being runners-up on that.
50 plus project. Me and you's a fair bit they go on that, Jason. The rest of them's all snooker, but me and you'll be all right.
I'd like to declare an interest, I think.
Item number 11. So that's proposed by Councillor Duffy, seconded by Councillor McDade. Huh? Sorry? Oh, did he? Sorry. Beg your pardon. Councillor Heaney seconded first there, and also declared an interest of someone over 650. Item number 11, the draft response to the Department for Communities consultation, and that's Seamus. Yes, we can, surely. Members, item number 12 is open for information, but we actually need a decision on it, so I'm going to bring that and the open for decision. So item number 12 is Barry.
Thank you, Chair. Members, I'll not go into the detail around it, but the report is to give you an update in terms of our access and inclusion funding through DFC and our successful application for an outreach disability hub. The application focused on the purchase of specialised bikes, which will allow us to deliver specially adapted physical activity sessions to those with both physical disabilities and learning difficulties. And the purchase of storage containers, a vital part of delivering this. This is building on the success of our Disability Hub programme based at Foyle Arena. And this project will then extend provision into the rural areas. So council must spend all of the grant of 30,000 by the end of March 2024. Two appropriate sites must be identified for the mobile hubs, and key partners have to be identified to bring added value to the project. So members, the recommendation is you approve the acceptance of the letter of offer for the Disability Hub project. Thank you, Chair.
Thank you, Barry. Councillor Duffy. Standard Duffy.
Just briefly, to propose it, but to say that last year we did that taster session, and it was a female taster session in Foyle Arena, and we had some of the disability bikes out, and I have to say they were excellent. It was the first time I had a chance to see them, so I'm glad to see that that's been extended. So thank you.
So proposed by Councillor Duffy, seconded by Alderman McMorris. Yeah. Okay. Members, moving on. Item number 13 to 21 is open for information. If anyone wants to speak to anything, look, Councillor McDade.
Thank you. Just very briefly, I mentioned it whenever we were talking about the dog wardens. Item 16 is the statistics from DARE about noise complaints. And it's not a question or anything else, just a comment on the amount of complaints I'm getting about dogs barking. It seems to be a meeting today about dogs. I don't know why. And I love dogs, but it's just, there seems to be an awful lot about it. And I suppose I've been working closely with Niamh Corey, and she has been really helpful. So just to put that on the record, that she has been really helpful, keeping me informed of what's been going on in this particular case. Thank you.
Thank you for that, Councillor McDade. No. Okay, members, moving on. Can we go into confidential, please? Yes. And can IT just let me know when we've